Meanwhile, in this country, the prospects are much better for many AIDS patients. Many, but not all. NBC's Rick Davis now on those who are fortunate and those who are not.
Oh, that's what I actually usually do these days.
2 years ago, this run would have been impossible for Sean Strub. His body was ravaged by the AIDS virus.
Physically, I was having difficulty walking, I had great difficulty concentrating. I weighed about 35 pounds less than I do now.
And skin cancer marked his body.
About a quarter of my face was covered. I was having difficulty breathing.
In January 1996, Strub began taking a cocktail of drugs, including protease inhibitors. It is not a cure, but in many cases, the drugs stop the virus from invading healthy cells.
Within a couple of weeks of starting the combination, I was feeling better.
But Dr. Howard Grossman says the good news is limited to North America and Europe.
We have access to medical care, access to drugs that just are beyond the hopes of people in developing countries. And the epidemic has changed tremendously for us, and we're really lucky.
As the editor of an HIV-related magazine, Strub knows the statistics. Not everyone is lucky, including a friend.
I responded to the therapy. He didn't. He died 2 days ago.
The pills are not magic bullets. The failure rate is at least 20%.
The people in hospitals now are desperately sick, people who failed therapy, or for whom the therapy failed them is more likely, and poor people who don't have access to drugs.
That is a fact of life right now. It doesn't mean we can't change it, but until we acknowledge that the rich get to live, the rich get to be healthy, and the poor don't, and sort of say, yeah, that's the way it is. Now what do we do about changing it?
The long-term effect of the drugs is uncertain. Right now, Sean Strub is enjoying what he calls the bonus round in the game of life. Rick Davis, NBC News, New York.